All right, we're ready for our first speaker, and you're going to like this. This is Joe Prisco. And Joe Prisco is the Director of Rehabilitation Services at Sutter Lakeside Hospital. We're bringing you the heavy hitter. This guy directs everything. Joe Prisco hails from Chicago. We won't hold that against him. But I'll tell you what, he found Lake County, so he gets kudos for that. He served honorably for several years in the U.S. Air Force. Okay, Joe, I'm Air Force also. We're together. Following his military service, Joe pursued his passion for healthcare, earning a degree in physical therapy from Long Beach State, a competitor. I was at Sac State. Driven by a desire to specialize and excel in his field, Joe pursued a postgraduate credential in spinal orthopedics, specializing in the McKenzie method. This methodology, renowned for its effectiveness in treating spinal issues, became Joe's area of expertise. I'll be seeing him later. For the past 25 years, Joe has dedicated his career to serving as the Director of Rehabilitation Services at Sutter Lakeside Hospital. In this role, he has demonstrated exceptional leadership and a commitment to providing top-notch care to his patients. This was written by Sutter Lakeside, by the way. Joe's dedication to improving the lives of others through rehabilitation services has earned him respect and admiration both within the hospital and the broader healthcare community. Please join me in welcoming Joe Prisco. One, two. There we go. There's your standalone.
Thank you. I know a lot of you in here. Can everybody hear me okay? You guys good? You hear me in the back? Good. Okay. So the title of this little talk is called Exercise is Medicine. So I want you all to just imagine something. So everybody just kind of close your eyes and imagine. This is a fantasy, but we're imagining here just for a moment. So imagine there's a pill you could take, magic pill. I'm not a pharmaceutical representative, so this is not that. Imagine there's a pill you can take that would increase the strength of your bones. And imagine that pill could make you stronger and make your muscles grow. And imagine that pill, that's better, closer? Okay. And imagine that pill could increase your energy level, improve your circulation, improve your mood, decrease depression symptoms, decrease anxiety symptoms, give you more energy, and there are many other benefits. But imagine if we had a pill that could do that with no side effects. Would you all take that pill? I'd take that pill. I would definitely take that pill, but unfortunately there's no pill like that. So the thing that is very much like that is medicine, because you take it, is exercise. Exercise does all those things. But in my years here at Sutter Lakeside, 25 plus years, I've discovered that people just don't know how to do it. And if you don't know how to do it, it's hard to get results, right? If you do something that takes effort, you want results. So I'm here to talk to you a little bit about how to do it in a general sense. Now, we all have a lot in common. We all have one thing in common in here, though. What do we all have in common here? We're all getting older, right? We're all getting, and you know that's fun, right? It's a lot of fun, a lot of aches and pains. We all go through that. That's common. I'm 105. I know what that's like. I'm 58. But we all go through that. And there are a lot of myths that are attached to exercise and getting older. A lot of myths that kind of deter people from doing it. And I'm going to read a few of those to you. We'll talk about that. So one myth is that older adults should avoid lifting weights. That's a myth. Absolutely untrue. Number two, exercise increases the risk of falling. No, it doesn't. If you do it right, it actually decreases the risk of falling. Myth number three, exercise will make my arthritis worse. That's a myth. If you do it right, it won't. It will actually help symptoms of arthritis. You guys have heard of the term motion is lotion, right? Movement lubricates joints. Very good. Exercise is a wonderful treatment for arthritic problems. And I mean, who's got arthritic problems when you get older? A lot of people. A lot of people. Number 4. Now, this is the myth that I've heard the most of in my years. This is the mother of all myths. Exercise won't do me any good. I'm getting old. That's a myth. That's an absolute myth. And to illustrate that, I've got a story to tell you. Real thing, real story, real guy. Guy's name is Gaetano, and Gaetano's 95. And his wife's name is Shirley, and Shirley's 97. And they've been married 69 years. And they were going along just great, living alone. He was driving. His energy level was like mine. He could do anything. He could walk alongside a river back where he lived, uneven ground, no problem. Never used a cane, never used a walker. He was on various boards in town, very sharp, had all kinds of energy, drove a car. Well, his wife Shirley started to kind of go downhill functionally. She was getting older, she was losing her sight. She was getting to the point where within a year's time, he had to help her with everything. He had to help her out of bed. He had to help her to the bathroom. He had to help her shower. He had to help her eat. She wasn't walking well, so he would have to be with her when she walked. So his life was consumed with helping his partner, and he would not have it any other way. He told his family, she took care of me for 69 years. Now it's my turn to take care of her. So this vibrant man doing so incredibly well within a year's time had gotten to the point where he had to use a walker, was falling down frequently, wasn't sleeping. His energy levels were terrible. He was even complaining that his memory wasn't good. He wasn't remembering things. His cognition wasn't good. He was scared to go outside. He was scared to do things. Well, at the time of her death, about a year ago, it was a year ago, April, Shirley died. Even to go to the funeral, he had to have a lot of help to get there. And when the family walked out to the gravesite, he had to have somebody on either side of him just to get him to the gravesite. So after the funeral was done, one of his daughters took him to the doctor and said, "What's wrong with this guy?" The doctor looked at him and said, "Okay, I'll do blood work." The blood work came back okay. All the numbers were good. And the doctor commented to Gaetano's daughter, said, "Well, he's 95, almost 96. And so my daughter left there very frustrated, as was Gaetano, very frustrated. Well, my daughter didn't accept that and said, "You know what, Dad? If you're willing, let's go. We're going to get you on an exercise program. We're going to feed you." He had lost 25 pounds, by the way, in that year. He was very emaciated looking. She said, "We're going to feed you. We're going to take care of you. We're going to come to the house, and we're going to make sure you exercise. We're going to get out there and walk. We don't care if it's with your walker or not." So fast forward 6 months. 6 months later, Gaetano's not using a walker anymore. Gaetano's not using a cane anymore. Gaetano's taking walks down by the river now. He's walking around at home. He's fine. He's on these boards that he's always been on his whole life. He's thinking clearly. He's got great energy, and he's sleeping well. And he's happy. He misses his wife, but he's happy. So that kind of flies in the face of this idea that just because you get old, you can't get better exercising. He's a proof positive that is not necessarily true. So that brings me to my next little comment about this. But how do you do it? How do you exercise? What do you do? What are the guidelines? We've got some really good handouts. One by the American Heart Association. They're back there on that table, and it gives you guidelines as far as how often you should exercise, what you should do in general. Great handout. And the second handout is really exciting. It's by a company called MedBridge, and there's a QR code on here, and there's a website. You can go on this website, and you can actually download videos of exercise instruction. So you don't necessarily have to visit a physical therapist or a trainer. This website is just phenomenal. Literally hundreds and hundreds of exercises. So it's very good. for learning your own program and going forward with that. One of the things that they say on the American Heart Association handout, they talk about vigorous exercise, and they talk about high-intensity weight training for older people. I mean, does that sound scary to any one of you? High-intensity weight training, it sounds scary. It sounds scary. If it's done right, it's very safe and it's not so scary. There's a quote about exercise in older people that I found in lifting weights that I find interesting. Here's the quote. If you think lifting weights is dangerous, try being weak. Being weak, now that's dangerous. So working out, lifting weights is very safe under the right conditions. Does anybody lift weights in here? Does anybody exercise, lift weights? Yeah, good, good. So, but before we get into, I'm going to instruct you in a couple things. Before we get into that, we have to talk about safety. So before you embark on an exercise program, whether it be aerobics or whether that be weight training, if you have an underlying health condition, check with your doctor. Always check, or check with your rheumatologist, or check with your orthopedist, but make sure it's safe for you to do this stuff, right? The second thing is, before you exercise, you should always warm your body up. Who has heard of stretching before exercise is the best thing to do? That's not true anymore, right? It's absolutely not true. Stretching should be done after you finish your workout. So the idea is, before you work out, you should warm up. And what warming up means, warming up is a 5 to 10 minute activity that gets your heart rate up and warms your body up from the inside out. So for instance, a brisk walk for 5 to 10 minutes, right? If the weather's bad, you could pace up and down your hallway for a few minutes. If you don't have a long hallway, you could just do this, move your arms and legs, do that kind of thing for 5 minutes. But warming up gets your muscles prepared to work out and decreases the risk of injury. So always warm. We always say in our PT lingo, don't work out cold. So get your body moving first. So the second thing is, when you work out, you need to do it at a regular interval, 2 or 3 times a week. Doing it once a week generally isn't a good thing. So 2 or 3 times a week at least for working out. Now, the other thing is, the safety part is the form that you use. Your form should be a certain way. You shouldn't rush working out. You shouldn't hurry it. You should just take your time with it. And it's good to make it convenient. You know what I hear from a lot of people about working out? I hear, I don't have time to work out. Does anybody here not have time to work out? Yeah, I mean, people are busy. We get that. I'm busy. I work long hours. And when I was younger, I worked out after work. That wouldn't work for me now. I'm in my 50s. When I'm done working, I want to go home. I want to have dinner. So what I do, I work out early in the morning because it's convenient. So one of the things to think about before you start a workout is, when is it convenient for you to work out? If it's convenient, chances are you're going to be more compliant. So just food for thought about kind of how that works with getting into a program. You have to do it in a way that is convenient for yourself. Make sense? Okay, so principles of exercise training. I brought some props here. So we're going to talk about strength training, because strength training generally isn't talked much about, and it's not emphasized enough. But it is really important for older people to strength train. Extremely important. You want to keep your muscle mass. You want to keep the strength on your body. Strength means better function. Strength protects your joints. Strength allows you to crouch down in your garden and pull those weeds out. And if you're like my garden, I got a lot of weeds this spring, lots of weeds. So all of these things take strength, and they take balance too. We're going to focus a little bit on strength. So this is a small weight, if I do this a bunch of times, I'm not feeling much. Is that 8, 10 times? I could do this 20 or 30 times. This is an exercise for my biceps muscle here. So if I do this 30, 40 times, am I strength training is the question. Is this strength training me? No. Yeah, not strength training. So this is a misconception people have. People come into the clinic and they are very frustrated because they're not getting results. I mean, none of us like to do something and put effort into something where we do not get results. You want to see results. You want to see a positive result. So for me, this is more like what I need. So if I was to do this weight for this arm 10 to 15 times, that's kind of the protocol, 10 to 15 times, lower repetitions, I begin to feel tiredness of the muscle. I begin to feel kind of what you would consider a burn, right? You guys know what I mean, like a fatigue. So I'm feeling fatigued now. So you've got to use a weight intense enough to give you that feeling of fatigue. So the protocol for strengthening is use a resistance where you do 10 to 15 repetitions, and during that time your body gets tired, your muscle gets tired and fatigued. The thing we hear most from people when they get fatigued, they say, man, it burns, right? That's not to be confused with pain. You've heard the no pain, no gain mantra. You guys have heard that? It's not true for strength training. You shouldn't hurt. It shouldn't give you acute pain. But the burn and the fatigue part, that's what you should feel when you do strength training. So the protocol for strength training is lower repetitions. So I might do that 10 to 15 times, and then I would rest. The time it takes for me to do it, I would rest, and I'd do 2 or 3 sets of that. That applies to any body part whatsoever. So strength training protocol. The other thing about strength training is you've got to have good form when you do it. You don't want to throw the weight up. You have to use good form, tighten your body, straighten your spine, and go slowly when you do it. We use a phrase before people strength train. We tell people to get tight. So tighten up your muscles and then strength train. Create stability when you do that. That way you're going to avoid injury. So people often say, how long does it take to get stronger? It takes a little while. It takes several weeks. So oftentimes you won't get results in 1 to 2 weeks, but it takes several weeks, 8 to 10 weeks of doing this before you're going to see a result in most cases. Does anybody strength train like that? Does anybody do that? A few of you do that? Good, good, yeah. There's great information out there on the internet, but you all probably know the internet's full of a lot of information that much of it isn't very accurate. So what we always recommend, the MedBridge website on the handout, great resource. Physical therapists also have websites that will give you some good guidance. Does anybody want to come up and be a volunteer to demonstrate something for me? Anybody? Anybody who's strong? Here, you want to come up? We're going to demonstrate strength training. You guys know what these are? Yeah, this is an elastic exercise band. All right, what's your name, sir?
Richard.
Richard. So Richard, I want you to grab that band, and I'm going to do it with you, and you step on it. All right, and you're going to turn your hand this way, and you're going to do 10 repetitions just like this. Just do 10, not too fast. And as you're doing it, Richard, what are you feeling? Is it burning?
Yeah.
Okay. Is that painful?
No.
How many is that, you guys? Are you counting? 2 more. 1 more. All right. Okay, Richard, so describe that. Did you feel a muscle burn or muscle fatigue?
I did.
Okay.
Burning.
Okay, so Richard then he's in the strength training slot. He's right there. Now, if he didn't feel that, if he was to say, oh, well, that was easy, that was nothing, I would say we have to increase the resistance. But you don't sacrifice form for resistance. So if Richard had done this, that's what we call poor form. Or if Richard was lugging the band up like this, that's not good form either. So if you noticed, his back was straight. He was doing everything he needed to do to keep himself safe. So that's the pace when you strength train. We never advocate doing things quickly when you strength train. Does that make sense? Yeah. All right, Richard, I have a gift for you. Here's 3 of these. So this is lighter, this is a little heavier, this is super heavy. This is for when your muscles get really big. Right here. All right, thanks a lot.
Thank you very much.
Give Richard a hand. So on the MedBridge handout, I have a couple examples of exercises, and I'm going to demonstrate one for you today, and you guys can do it with me if you want. Has anybody done a chair squat before? So a squat exercise, I don't mean a deep knee bend. When I say squat, people think that means to do this. That's not what I mean. So a chair squat is simply an exercise. You don't want to miss the chair, by the way. It's an exercise where you sit and you come back up and you keep the tension on your legs the whole time. All right, anybody want to try it? Let's get all 200 of you up to do this. Or maybe 20. Okay, here we go. So, the chair squat, the squat exercise is the single best leg strengthener there is. But you got to do it right. If you do it wrong, it can be a problem. What's your name? Gary? All right, Gary. Gary's a tall guy, like me. Tall guys have to really widen their stance quite a bit. So what I'm going to have Gary do is widen your stance, right? And before you squat, you want to make sure your posture is good. So you want to look up, and you want to push your bottom back into the chair. Actually sit into the chair, and then pop right back up. Good. Do about 5 of those. So the idea is you're sitting back in the chair, and you're not really letting off the tension of your legs. You're still keeping tense. Keep tension on your legs. How's that feel? Down, up, good. 2 more. 1. How does that feel? Is it burning?
Not yet.
Okay, 1 more. Okay, very good. Very good, thank you. So the idea behind a chair squat is it's easy to do when you do it in a chair. We recommend that you have your feet apart. It gives you a good base of stability. We recommend that you're up straight. If you're not up straight, you tend to tip this way. And when you tip this way, there's a better chance you're going to go that way, which is not the way we want to go, right? So once again, squatting, your bottom goes back, and your head is up, and your spine is straight. So we do this in physical therapy for people that have had spine surgery 5 and 6 weeks before. That's how safe this is if you do it right. Basic chair squat. Again, that's on your handout there. So it's always about safety when you exercise. And this is why older adults can do it successfully. Because let's face it, as we get older, our balance is a little bit off, our strength is a little bit off, and we have joint pain. So doing things safe is absolutely required. What about balance? Now this is not quite a strength thing, but it has to do with balance. Does anybody have balance troubles? Yeah, balance. As we get older, our balance kind of falls off a little bit. So I'm going to show you one good exercise for balance, and you can do it with me if you want. Very simple, very effective. It's called single leg balance. So you start up on your feet. Again, always emphasize good posture. Shoulders are back. Belly's tight, so meaning you tighten your belly a little bit. 1 hand or 2 hands on a chair. You can also use a kitchen counter, right? Hand on the chair. Lift one leg. Your knees bent just a little bit, and hold on to that chair. And then let go. And when you start to kind of get unstable, grab the chair again. And repeat that. Let go. Hold on to that. Come back, and then switch legs. Sometimes 2 hands is better. Let go. Back and forth. So I have a story to tell you about a lady that was in my exercise class. We teach exercise classes at Lakeside 2 days a week. And I had a little 82-year-old lady came in, and she said, "What is this business about exercise?" And I said, "Well, you can join the class if you want. We do balance and we do strength training." And she goes, "I don't know about that stuff. I've tried that. Doesn't work." She goes, "All I want to be able to do is lift my foot." She was hanging on. "Lift my foot, take my slipper off, put it down, pick up my slipper, put my slipper on without holding on to anything. I can't do that anymore," she said. I said, "Oh, okay. Well, I can't guarantee you're going to be able to do that. But if you come to class, give it a shot. See what you think." And she wasn't particularly friendly. She came into class, she didn't say much, and I thought, okay, well, okay, it is what it is. About 2 months later, she comes into class and she walks up to the front of the class and she stands there without holding on to anything. She takes her shoe off, she waves it like this, she puts it back on her foot, puts her foot down, and said, I could not do this two months ago if it wasn't for this class. So that was just kind of a really good testament to, okay, she did her homework, she did the exercise, it works. So exercise does work, but I advise all of you, get some guidance before you start a program, either from a good program on the internet or from a physical therapist. This is kind of what we do for our expertise is exercise. Make sense? So to wrap up, please grab a handout. There's great guidance as far as how often you should do these things. There's a whole different type of exercise you all know is cardio exercise, heart exercise, very important also. The American Heart Association handout gives you some guidelines. But remember, strength training is important. Strength training is shown to be more and more these days a vital part of aging healthily, right? We all want to age in a healthiest way possible. We all want to be able to go out to the garden. We all want to be able to hold on to our grandchildren. We all want to be able to do those things as long as we possibly can. So I'm going to close with a quote. Not my quote, but I thought it was a good one. The quote goes, I exercised once, but I found I was allergic to it. My skin flushed, my heart raced, I got sweaty and short of breath. So that's not an allergy, folks. Thank you very much.